Hospitals say they are seeing more and more numbers of unvaccinated mothers-to-be seriously ill with COVID-19. That's why the CDC sent out a message urging pregnant women to get the vaccine. But many expectant moms may still be hesitant. Joining us this morning with a look at why doctors feel it's so important is Dr. Paul Dutreil, the Director of Maternal Child Health with Touro Infirmary. Hi, Dr. Dutreil. Good morning.
Hi, how are you?
I'm good, thank you. So first, let's start with the number of vaccinated moms-to-be. It's a pretty low number nationwide. Only about 23% of expectant moms have received the COVID-19 vaccine. Why do you think that number is so low?
I think inherently there's always some concern that women who are vaccinated with pregnancy are going to put themselves at risk, or maybe their newborn or their unborn child at risk from these vaccines. And there really isn't any proof of that whatsoever. I think locally there are a little bit higher numbers, but we still need to increase our vaccination.
People are worried. You're hearing about things like stillbirth, having a miscarriage, or, passing on some sort of problem to their unborn child, right?
Absolutely. And the information that we have after looking at probably over 140,000 women who have been vaccinated during the course of their pregnancy as of the end of this July, we've not seen any increased risk in anomalies. We haven't seen any increased risk in miscarriage, stillbirth, or other pregnancy complications like diabetes or high blood pressure.
So again, the studies have shown that there have not been any adverse effects for women getting the vaccine who were pregnant.
Absolutely none.
Okay. Right now, are hospitals seeing an abnormally high number of pregnant women coming in with COVID-19 who are unvaccinated?
Unfortunately, we are. Part of the issue with pregnancy is that there are a lot of lung changes and immune system changes that do put them at a much greater risk compared to people who are not pregnant. They're much more likely to get admitted to an ICU, potentially have to get on a ventilator, and even more likely to, unfortunately, die from the virus than somebody who is not pregnant.
I mean, it's heartbreaking to hear that when you think about just how fragile, obviously, the mom's life is, the baby's life while they're pregnant, and then to take it a step further, then they get COVID. I mean, it's just heartbreaking to hear that.
Oh, absolutely, especially when we have something that can protect them.
Have you seen any patients that have had complications from the vaccine?
Absolutely none.
Okay,
You'll see a little bit of soreness in the arm. You'll probably have maybe some flu-like symptoms, but that just means the vaccine's working. That your immune response is being mounted against the virus. So it's a good thing.
What about somebody out there who's thinking about getting pregnant, maybe trying to do so, or just thinking about getting pregnant? Should they get the vaccine? Is it safe for them to do so?
Absolutely. There are no studies that support any of the thoughts that there could be problems with infertility down the road. And the way that this vaccine works has nothing to do with how someone could feel. Absolutely, it's completely safe, and I would highly encourage any moms that are thinking about having another child or their first child to get vaccinated.
Okay, and do so sooner rather than later as the Delta variant surges.
Absolutely.
All right, Dr. Paul Dutreil, thank you very much for your time this morning. We appreciate it.
Absolutely, thank you so much.